Hello and welcome to 21 Portland Place, the headquarters of the Association of Anaesthetists of Great Britain and Ireland. I'm Harrop-Griffiths, I'm Vice President of the Association, and with me today is Dr. Ranjit Verma. Dr. Verma was chairman of the working party that has produced one of the Association's latest safety guidelines entitled Pre-operative Assessment and Patient Preparation. Dr. Verma, good morning.
Good morning.
Ranjit, surely anaesthetists are just the people who keep us asleep during operations. Why do they have to see patients beforehand?
Anaesthetists have a far greater responsibility than putting a patient to sleep and waking them up. They have a responsibility to make sure that that they do, of course, wake up at the end of the procedure, but also to make sure that the patient is adequately prepared so that the risks associated with anesthesia are minimized as far as possible.
Now, I understand that your guideline document makes a lot of mention of pre-assessment clinics. What are pre-assessment clinics?
Pre-assessment clinics are, as the name implies, clinics, hospital-based clinics essentially, where there is a team of people, which involves not just the anaesthetist, but also the specialized nurses, other staff dealing with the patient, who can not only assess the patient but make sure that their level of fitness is as optimal as possible, to make sure that the patients understand what they're coming in for, what is going to be done to them, and of course to give the patients an opportunity to ask questions.
So what happens if the patient isn't very fit? What happens to them in the pre-assessment clinic?
This depends, of course, on the individual patients and how unfit, if I may use that term, they are. If it's a relatively minor thing, then that can be addressed either there and then by advice from the pre-operative assessment team, or they can be filtered back to the general practitioner. For example, if a patient has high blood pressure, it would be unsafe to carry on and give that patient an anesthetic if surgery can be avoided. And in that situation, one would recommend that they start some appropriate treatment, monitored by the general practitioner, bring the blood pressure into normal levels, and then come in for the surgery. So things like this, those can be addressed. If they are more seriously ill, or if there are more serious problems with them, with the individual, then the patients may need further investigation and treatment before surgery can be proceeded safely.
Do patients also get the opportunity to talk to the nurses and the anaesthetist about the details of what's going to happen to them during, before and after the operation?
This is very much part of the pre-operative assessment process. The patient is given opportunity to ask questions and to highlight any fears or anxieties that they may have, which can be addressed appropriately.
Should every patient who's undergoing surgery go through a pre-assessment clinic?
The problem we have at the moment is that many hospitals do not have a pre-operative assessment clinic per se, although most of them have mechanisms whereby patients can be assessed pre-operatively. This may involve contact with the nurses, specialized nurses who have trained in this field. So to answer your question, although it may not be practical for them to go to a clinic because the clinic doesn't exist, but they should have an opportunity to speak to somebody who is involved with the pre-operative assessment process beforehand.
Do the nurses and anaesthetists who work in pre-assessment clinics need special training?
The doctors who train as anaesthetists go through a long and rigorous process of training, and it is part and parcel of that training that they learn about pre-operative assessment and to evaluate and judge risks for a patient who is to undergo anesthesia. Nurses, of course, are a different kettle of fish. Nowadays, there's a lot of interest in extended roles of nurses, where nurses either train formally through courses or which can be national or local, whereby they develop special interest and expertise in different fields. And nurses with interest in preoperative assessment fall into one of those categories.
Does every hospital in this country have a pre-assessment clinic?
Not every hospital in this country has a preoperative assessment clinic, but our working party recommends that most departments of anaesthesia should consider setting one up. This will of course require a great deal of support from management, because these things are not cheap and have to be funded appropriately
Are you saying, in effect, that there is insufficient funding for these clinics in the UK?
I think that would be fair to say, yes.
Two final quick questions, Ranjit. If I go to a pre-assessment clinic, can I ask for a particular sort of anaesthetic to be planned as part of my surgery? So if I want a local anaesthetic or an epidural, is that the time to ask an anaesthetist for that sort of anaesthetic?
You have to realize that the pre-operative assessment process is a team approach, or should be a team approach. That involves not only the surgeon and the anaesthetist and the nurse and the theatre staff, but does very much involve the patient as well. There is no harm in requesting a particular type of anaesthetic, but the decision of exactly what type of anaesthesia to administer or to give to you will depend on several factors. And all members of this team need to think it through and come to a consensus and an opinion which would ensure the best, not just the best quality of anesthesia, but also the safest safest route by which you can have your operation.
Are you saying that it's not my decision?
I think the choice of anaesthetic depends on the advice that the professionals are able to give to you, and the ultimate decision has to be that of the patient, but it has to be based on appropriate advice given from all members of the team that are involved with the preoperative assessment. And particularly, the individual needs to understand and appreciate the risks involved in different types of anesthesia. And it is only once you've received all the information that you can make an informed choice.
Ranjit, one final question. As a patient presenting for surgery and possibly to the pre-assessment clinic, what can I do about my own lifestyle that could decrease the risk of surgery?
There are several simple things that individuals can do to enhance safety and promote a safer anesthetic. Improvement in general fitness is the commonest. So things like, if you smoke, you should stop smoking. If you are overweight, you need to address that issue and perhaps lose some weight, improve your fitness level, and so on. And then, of course, it's important to go and see your GP, and if there are any simple issues that can be addressed relatively easily, such as high blood pressure and so on, all these things need to be addressed before the surgery is undertaken.
Well, Ranjit, I'd like to thank you very much for coming here today to 21 Portland Place, the headquarters of the Association of Anaesthetists, to discuss the latest AAGBI safety guideline on preoperative assessment and patient preparation. Copies of the guideline will be sent out to the Association, and the guideline is available for download as a PDF from www.aagbi.org.